Hi, I'm Dr. Kelly Wallace with Catawba Heights Animal Hospital, here today to talk to you about cat vaccines. I have a couple of questions that we're going to answer. Are cat vaccines necessary? The short answer is yes. Rabies is required by law here in North Carolina. It is required by 16 weeks of age, and it's either a 1 year or a 3 year vaccine based on the pet's vaccination history. We do see various diseases in this area. We do see panleukopenia, which is feline parvo, which is very contagious and often fatal. We also see feline leukemia and feline AIDS in this area. What cat vaccinations are typically recommended and what are they for? The cat distemper is frequently called FVRCP for feline viral rhinotracheitis, calicivirus, and panleukopenia. That is a core vaccine, meaning all pets should receive it as it vaccinates against very common diseases that are easily prevented with vaccines, but are often fatal if caught. Rabies, which is required by law. Feline leukemia virus is typically recommended in kittens that first year. It's a series of 2 vaccines. If the pet at 1 year of age is still indoors, then you can opt to skip the vaccine. But young cats are more apt to get out, explore their environment, and get into fights. And leukemia is passed through saliva, so licking, grooming, playing, fighting, you can pass that virus. So we do recommend that kittens receive the first set of vaccines just in case they get out. They have at least seen the vaccine to have some protection against the virus. And then we also see feline AIDS virus in this area. It is a virus much similar to the human's AIDS virus, but humans cannot catch this virus. Unfortunately, there's no vaccination for it in the United States. But we do recommend, like with feline leukemia, indoor cats are less apt to get into fights and can catch it. Another vaccine that we don't really use much anymore is feline infectious peritonitis, or FIP. That vaccine is not recommended anymore, so we don't give that. What is the vaccine schedule for kittens? So for kittens, we recommend the distemper parvo or FVRCP starting at 6 to 8 weeks of age, and then every 3 to 4 weeks for a series of 3. Rabies is given sometimes between 12 and 16 weeks, and feline leukemia virus is usually given at 12 and a set of 2 after 12 weeks of age. Senior cats, depends on the lifestyle. If they're going outside, we definitely recommend the feline leukemia. But for senior cats, we do recommend the feline FVRCP and rabies. And after the kitten is 1 year of age and has received those vaccines at least once before, they're given every 3 years. So your adult and senior cats would only be receiving the FVRCP and rabies every 3 years. Leukemia is still once a year. Are there any risks or side effects associated with cat vaccines? Like with any vaccine, you can have a reaction. A mild reaction, just a mild symptom of vaccine, is you can run a slight fever after vaccine. You may have tenderness to the touch at the vaccine site. That's common with any vaccine. A big reaction, a true reaction in a cat, is typically going to be vomiting. And typically you see that within a couple of hours of vaccines. There can be what we call an anaphylactic vaccine reaction, which is kind of like when people who get stung by bees and are allergic to it have to do the EpiPen right away. Those pets are sick within minutes of vaccines. And typically they're here in our care because they're sick pretty quickly. We give them medications to help overcome that reaction. If they do have a vaccine reaction, we recommend in the future that they are given medications prior to vaccines to prevent that reaction. There is one side effect or risk of vaccine with the feline leukemia virus is a fibrosarcoma, which is a cancer of the connective tissue of cats. With the changing in vaccines, technology, we are seeing a reduction in fibrosarcomas caused by the leukemia virus. The risk of leukemia in this area is much higher than the fibrosarcoma tumor that has been seen or associated with these vaccines. So I do recommend vaccinating for them. We rarely ever have seen the vaccine-induced fibrosarcoma, but we see feline leukemia pretty frequently here. So that is one thing that you need to know about feline leukemia virus is there is potential for fibrosarcoma, but it's very, very low percent versus your pet actually catching leukemia, which is much higher in this area. If my cat is going to live strictly indoors, do they still need to be vaccinated? Yes. 1, rabies is required by law. 2, pets can get out, and you don't know when they're going to get out. And if they get out and they've been vaccinated, you're fine. But also boarding facilities and taking your pet to the vet, say they need a dental cleaning, spay, neuter, or they need surgery, vaccines are required, just so pets can't spread diseases among other pets in boarding facilities or at veterinarian offices. And then also people sometimes decide to adopt pets. You can't plan when that adoption is going to happen. So if you're going, if your pet's vaccinated, you don't have to worry about your pet being introduced to something that they may not be vaccinated for and could hurt them. Why is it important to avoid missing a cat vaccine? It's easy to do. Life gets away from us from time to time. But by keeping your pet up to date on vaccines, they're much less likely to come into contact, or they'll come into contact and they won't get sick from various viruses that are out there and bacteria that we vaccinate for. It'll allow your pet to live a longer, happier life, as opposed to being under-vaccinated and potentially catching those diseases. If you have any questions regarding your cat vaccines, please give us a call. We're here for you.